So hello everyone, welcome to my new video. So today I will discuss with you all about the eye clinical measure findings. That means those findings that we see in our day-to-day OPD practice, and I will discuss with you all about those things very nicely with you all. Okay, so let's start. So let's start from the first finding. So it is called as Ankyloblepharon. What is ankyloblepharon? So ankyloblepharon is the partial joint or fusion of the eyelid by skin. So it can be congenital abnormality. So ankyloblepharon can be in two types. One is complete and another is partial ankyloblepharon. So this condition can be congenital or acquired. So here acquired cases or acquired causes can be due to trauma like burn, chemical or physical agents. It also can be due to Stevens-Johnson syndrome. It can be due to trachoma, or tarsography is also one type of creating ankyloblepharon. Okay, so here in tarsography, suture is there putted in between these two eyelid to avoid exposure type of keratopathy. Okay, so let's go to the second finding. So it is ablepharon. So ablepharon, so it is the absence of eyelid or limited development of the eyelid. So it also can affect the patient's skull, skin, finger and face. Infants with ablepharon will have thin wrinkled skin, excessive facial crease, wide set eyes and wide fish-like mouth with bored nasal bridge. Okay. Now, Blepharophimosis. So Blepharophimosis is the reduced dimension of palpebral fissure height. So it means that the horizontal shortening of the PFH, it will induce the eye sign like narrow PFH, ptosis where you will see droppy eyelid, telecanthus where you will see widened intercanthal distance, and epicanthus inversus where you will see prominent skin fold extending to the lower and upper lid. Okay, this is the blepharospasm. So blepharospasm is the involuntary contraction of the eyelid, which is mostly seen bilateral, where there is an episodic contraction of the eyelid muscle that is responsible for the closure of the eyelid. That is, I'm telling about the orbicularis oculi muscle. So the exact cause of blepharospasm is not that much well known, but it is thought that it happened due to dysfunction within the basal ganglia. So for management purpose, the most appreciated or accepted management is the use of botulinum toxins. Okay. So here the coloboma of eyelid. So eyelid coloboma is quite a very rare congenital developmental abnormality where where in the eyelid there is an absence of the development of the eyelid, where it lead to cosmetic disfigurement of the eye. It is not looking good. Also, like coloboma of the lid commonly affect the upper lid than the lower lid. So here surgery is only the option, where suture will place over this area to have to hide the coloboma. Distichiasis. So distichiasis is the extra row of eyelashes in the meibomian gland area. So this is called as distichiasis. Okay. Now let's talk about the Entropion, Ectropion. I already uploaded dedicated video on Entropion, Ectropion. Do prefer to watch that video. So here in Entropion, you can see Entropion is the inward turning of the eyelid margin such that the mucocutaneous junction run inward, leading the eyelashes rub the cornea, causing irritation, pricking sensation to the patient. So that's why the patient will feel the irritation, watering, foreign body sensation, photophobia, something like condition. So entropion can cause corneal or conjunctival damage that can cause corneal abrasion, scarring, new vascularization of the cornea. Whereas ectropion is the outward turning of the eyelid margin. So patient may experience symptoms like ocular exposure or inadequate lubrication because the punta is turned outward. So this is the ectropion. Okay, so here this is the epiblepharon. So what is epiblepharon? So epiblepharon is the condition where the eyelid pretarsal muscle and skin ride above the eyelid margin to form an extra fold of tissue that cause eyelashes to hold vertically. That is known as epiblepharon, where the extra fold of tissue is there. Because of that, the eyelashes are holded vertically. Okay, so but this eyelash will not touch the cornea. Okay, now there is Euryblepharon. So Euryblepharon is the enlarged palpebral fissure height aperture. So it is a congenital eyelid abnormality where there is a horizontal enlargement of the palpebral fissure is seen. So vertically the eyelid is small, but horizontally it get larger something. Okay, so this is the lag of thalamus. The lag of thalamus is simply it is the inability to close the eyelid. So that is lag of thalamus. Symblepharon. What is symblepharon? This is the adhesion between the palpebral and bulbar conjunctiva. So it can be due to Stevens-Johnson syndrome, ocular cicatricial pemphigoid, which is an hypersensitivity reaction because of that some keratinization is going on, and it can lead to adhesion between the palpebral and bulbar conjunctiva. Now this is the telecanthus. So telecanthus, it is a widely separated eye. So this condition can cause increased distance between the medial canthus of the eye. So that is called as telecanthus. So that's all friends. Thanks for my channel. Please don't forget to like my video, subscribe to my channel, and please don't forget to hit the bell icon so that you will get notification whenever I upload a new video. Thank you so much, and I hope this video helped you to understand quite more clinical things properly. Okay, thank you so much.